I took a cue from Dr. Azhar's earlier instruction to get up and start networking, on the person on your left and on your right. I did that. I followed that. And so now I can proudly introduce my new friend, Dr. Saishreyas Sundarajoo, all the way from Singapore, who's coming to present on how doctors can work with health tech companies as consultants. Please give a warm round of applause for Shreyas. Come, Shreyas. Stage is all yours, my new networked friend.
Good evening, everyone. I wish they had put me before Dr. Az, who just did such a wonderful presentation. I only hope half the people don't walk away from here after my session or during my session. But today I'm here to talk to you about how doctors can work with health tech companies as consultants. It's a very long title, but while we go through this, you will understand what consultants do, and maybe it will become a lot more simpler in understanding this complicated word. So what do consultants really, really do? So when I first met consultants, they looked like children in suits, just like I don't look like a child, but they look like children in suits talking about all of these jargons that no one seemed to understand. But as I stepped into the world of consulting, I slowly began to understand how work at the margins were being done. When I say the word margins, what I mean is when new things come to life, or when new programs are launched, or when new products are launched, there is a team of people thinking through what happens if this, what happens and then what next. So that's the job of a consultant. A consultant's job is to really look through the entire process of anything, whether it is a problem or whether it is a solution. So what consultants really do is identify problems, recommend solutions, and implement these solutions. Identify problems, recommend solutions, and implement them. Identify problems, recommend solutions, implement them. Does this sound familiar to you as a GP? Diagnose, prescribe, follow up, which is precisely what every GP does with their patients every single day. As doctors, our job every single day is to diagnose, prescribe, and follow up. And this is exactly what consultants do as well. So let me start with some stories. I have 3 stories for you here today, and I'll start with story number 1. I need to firstly apologize to all of you. I'm from Singapore, I'm not from Malaysia. I'm not going to fight you on whose food is better. Hands down, Malaysia wins. There's no doubt about it. Any Singaporean who says otherwise is lying. So story number 1. As you know, the Singapore government has always been looked at as a very efficient government because they look at a 50-year horizon. And so in that same vein, the Ministry of Health, right before COVID, was looking at digital health behaviors. So what are people doing on their phones? What are people doing in their lives? What are people doing in various aspects of the day? And how does that correlate to their medical problems? I know it's a very weird set of constructs, but if you really think about all the different things that we do on a daily basis, maybe we drink 5 cups of coffee with 2 spoons of sugar every single day. That's a behavioral pattern that might not reach your doctor, right? But at the end of the day, we know that some of these patients who have very high sugar intake are also obese and also might be at risk for diabetes. So this is something we know theoretically. But how do you measure this in a population? Very, very difficult to measure this in a population. And so while they were trying to crack how to do this, consultant came up with an idea, right? Hey guys, why don't we use wearable technology to start understanding what time people wake up, what their heart rates are like, how much exercise do they have, and see if we can incentivize people to have healthier behaviors. This is on the preventive side. I know it sounds like a massive invasion of your privacy, but to avoid that level of privacy invasion, what the Singapore government did was they partnered with Apple. So a lot of us are iPhone users. We know that Apple has come up with amazing user interface and user experience. And they partnered with Apple to allow Apple Watch users to pair their data with the Ministry of Health to then be able to match their daily behaviors and daily activities and try and marry it with the medical records that are there with the Ministry of Health. What this does create after that is a very, very powerful analytical tool of digital behaviors and their corresponding medical records. Very, very deep insights. And so about 200,000 Singaporeans actually have gone on this program over the last 3 years, and there have been tremendous insights from here. So that was Lumi Health, which is a Apple Watch app that then pairs with your national identification card, your IC, and then it pairs with your medical records as well. And that's how the Singapore government started understanding how to incentivize better behaviors. So how did they incentivize better behaviors? Very, very simple. Singaporeans love vouchers. And so every year, if you take 10,000 steps a day, every single day, we give you some number of coins. If you meditate every single day, we give you some number of coins. And throughout the whole year, if you follow the entire program, you walk away with 1,000 ringgit a year. It's a lot of money to spend, but we will only know in 10 years' time how effective it was. And people used to do this with the Fitbit. There was a prior program with the Fitbit. And you know what people did? They put it on their dog, took it out for a walk, give it to the child, go for a walk. But the Apple Watch, you cannot lie because it has to be connected to your phone and it tracks your heart rate. So that's how we became a little smarter, thanks to consultants, right? So they figured out why a program was not working out, analyzed that data, and then fixed it with an implemented solution. And so it's a very successful program that still runs till today. So that's story number one, right? So with the wearable and the medical records, what are the insights that you can get? This entire flow was designed by consultants, medical doctors who understood technology, who also understood what happened in the Ministry of Health with medical records, and then used that for precision public health. So that's a very, very wonderful use of technology, a very wonderful use of doctors' time to go into the future. Let me go to story number 2. How many of you here have heard about the gut microbiome? Huh? Okay. So the gut microbiome is the collection of all the bacteria in, on, around you. And there are so many bacterial cells inside you that there is a philosophical question that comes after this. We have more bacteria than human cells. Are we really humans with bacteria or just bacteria with some humans inside? And so this world of the microbiome has been very understudied up until recently. A lot of advances in this space has happened only in the last 10 to 15 years. And for most academics, the research material as well as the scientific data that was coming out on this subject was mostly from Western data. So these are people who eat fish and chips, people who eat hamburger, people who eat French fries and steak. That's the demographic of data that we're coming from. But in Malaysia, in Singapore, we have such a rich diversity in cuisine, we have such a rich diversity in ethnicities. Surely our microbiome must be different from the Western microbiomes. And so, how do you then design probiotics? How do you design effective microbiome therapies for people in Asia? We cannot just go and buy probiotics from the US or from the UK and take it and hope that everything works out well, because the bacteria there thrive in a different environment, are fed by different foods, and live in conditions or in genetic biomes of people who are different from the ones living here. So it would definitely not work as well as if we were to find bacteria that is common in this region of the world. And so a lot of the therapeutics that were available 10 to 15 years ago were not working at all for the Asian markets. This was identified by consultants, medical doctors who worked in this space, who understood the science and realized we should be sequencing the microbiome of the people in this region. And so that's what happened. Over the last 5 years, there has been a massive resurgence in sequencing the microbiota of the people of this region. We took it even further. So Monash University, Malaysia, has actually launched a huge program that actually went into the rural areas in Malaysia to go and find those bacteria that are not there in the cities. These are orang asli who have eaten in the kampongs, in the forests from there. Their microbiomes are so pure. It is untouched by the chips and the sodas and the processed food and the burgers and the fries that we city people eat. And that showed us what difference in microbiota compositions between these two different regions within the same country can be so different. So can you imagine how different it is from people of a completely different continent? And we have been relying on that data to do therapeutics in this region. How would it work? And so a team of consultants formed all of these different microbiota data and analyzed it, and then came up with, interestingly, fecal microbiota transplants for the people in Asia that is collected from donors within Asia. Fun fact, I was part of the team that did the screening for these fecal microbiota transplant donors. The best donors were females in their 30s who exercised and did yoga every day. Fun fact. Now, with that data, we were also able to make probiotics that were completely designed for the people living in this region. We eat so many different ingredients. The bacteria in our gut, very, very diverse. And so it's important that we analyze the bacteria that are good for us here and consume that as our probiotics. All of this not done by scientists alone. It is done in conjunction with consultants who are doctors. When I say consultants, I don't mean your specialist consultants. These are consultants who work in health tech, health technology, medical technology, as well as biotechnology. Now, I shall move to the last story. This one's a little bit more interesting, in my opinion. When COVID hit, Singapore went through a massive problem. We have designed our hospitals to be highly efficient, almost too efficient, and so our BOR rates are always 85% and above. So our bed occupancy rates in Singapore are always 85% and above. That means if anything happens, as a pandemic does, we do not have enough bed space for the surge in cases. And that's exactly what happened. Every hospital had its beds full. Every hospital saw that we just can't accommodate patients anymore. So what do we do in Singapore then? We can't build a new hospital. There are only few countries in the world that can do that very fast, right? China can do that. They built a hospital in 2 weeks. We can't because no more land, how to build more hospitals. So we had to think differently. And in that scenario, what we did was we started something called hospital at home. Why do the COVID patients need to be in the hospital? We can send them back home. We can administer IV at home. We can monitor them with wearables at home. All of this data can be on Wi-Fi or 4G, can be connected, and it can come to a central command center where one of our doctors can sit down and read and understand what's happening there. And if there's any emergencies, we can immediately activate an ambulance to go and pick them up. This started with COVID-19. And soon the hospitals realized, maybe we can do this for respiratory viruses, other respiratory infections. And slowly the acuity of care became more demanding. We started seeing cases of congestive heart failure, move back home. Infective endocarditis, move back home. We started seeing cases of rhabdomyolysis, move back home. And so right now, we have about 200 virtual beds all around Singapore. that are managed completely outside of the hospital. This, again, was done by a team of doctors who became consultants. They started effectively diagnosing the problem, diagnosing the organizational needs, started understanding the different complexity that revolved around it, and created solutions out of it. So our jobs as doctors is not just to treat the patient, it's also to change the system a little bit in whatever way we can. And that's what being a consultant really is about. So what did we do? We started admitting patients at home. And the program was so successful that last year, the Ministry of Health introduced it as a bill in Parliament. And so any Singaporean or permanent resident can actually have hospital at home whenever they want, as long as their doctor finds that this is a suitable solution for their condition. So we created apps out of it. And so this is the Speedoc app. We were the ones who pioneered it in Singapore, and now hopefully we will try and introduce it in Malaysia as well. But every single day, there are giant screens in the office where a team of doctors, a team of nurses look at what is going on with each of these patients. And every single day, we do hundreds of visits to all of these patients. Our doctors and our nurses are working from home. They don't come into the hospital. They don't come into the clinic at all. They're just on the road the whole time. And some of them love it in so many ways, things that I had not considered. One of the doctors said, I love doing this because I get to see the patient in an intimate setting, understand how their care is going to be for the next couple of weeks, and really identify socio-economically what they need. And I also get to try out the hawker centers everywhere in Singapore. So every day the team actually shares what they found where, and now people are asking, can I do a case there? I want to go and try the nasi lemak there, or I want to go and try the thosai over there, or the hor fun over there, very nice. So these are some of the things that happen as byproducts, but all of this could have been only imagined by doctors who really critically looked at the system and decided there must be a solution for this. And this is really what consulting is all about. So if I were to leave you with key takeaways, what your MBBS does is for the patient. Whatever you learn beyond that, all the skills that you really put to the problems that you're solving becomes the weapon with which healthcare systems elevates itself over the years. So for example, I started with UI UX for the Lumi Health app, understanding all of that. And then I moved into public health policy because we changed the way digital behaviors would work, and how do we incentivize the public at large to really relook public health policy. Then with research commercialization, how could we get this data from the microbiome, commercialize it with fecal microbiota transplants as well as with personalized probiotics. And then at Speedoc, clinical operations, P&L management, because it's an expensive business. You're employing doctors and nurses to go out every single day. So how do we make this cost effective for the patient? And then there are so many more things you can learn. All of these things that you learn adds value, not just to the patients, but also to your community of doctors. It also adds value to healthcare systems and the practice of healthcare in the long run. So it's really, really very important that all of us arm ourselves with as much of these knowledge buckets that interest us, because the intersections of this is what really, truly elevates healthcare. Doing your master's is an academic exercise, but learning about healthcare investment is good for the community. Your doctor friend comes up and says, hey, I have thought about this idea and I really think patients will love it. You now are armed with what investors are looking for. You know exactly how to make this idea come into fruition, into life, and by the bedside of the patient, and perhaps save many more lives. If you understand how P&L management works, you can understand how your clinic could actually benefit from doing other things. And if you learn perhaps some sales, for example, you know exactly how to sell the good thing to your patients, right? If there are non-compliant patients, how do you sell the idea of good health to them? It is a sales job at the end of the day. Convincing your patient to take their medications and follow through with the treatment is a real sales job, because how many patients actually follow the advice and how many patients actually don't follow the advice, you would know. So So it is a sales job. You are selling good health to your patient at the end of the day. And when I say sales, I don't mean selling things that the patient does not need. It is truly selling what the patient needs. So all of these different buckets of knowledge elevate healthcare systems. So key takeaway, every healthcare company needs a doc. And what do these docs do? They diagnose systems, they organize the complexity, and they create solutions. Diagnose, prescribe, follow up. Diagnose, prescribe, follow up. Diagnose systems, organize complexity, create solutions. Thank you very much.
Thank you so much, Shreyas. We're going to ask you some questions. Is that okay? Singaporeans don't take many questions, right?
No, I'll take questions. Take questions from anywhere.
Right, we're going to put up a QR code up there and you can ask questions. That last slide with so many buckets of knowledge, you know, I mean, junior doctors maybe not so familiar, but as you become more senior, every single circle, yellow circle there is related to what you do as a doctor. It's, you know, I know it's hard to digest, but that's the truth. And Shreyas is going to explain a little bit more once the questions start streaming. Anybody who's courageous? Yeah! A lot of courageous people today. Bravado.
Firstly, congratulations for disrupting the system. My question is, what was your biggest challenge when you were launching this Speedoc as an entrepreneur?
So, funny question. I'll tell you why.
Introduce myself.
I didn't, sorry.
Sorry, my name is Joanne. I am launching a telehealth platform called Menopause Asia.
Congratulations, Joanne. and wishing you all the very best and success in your new venture. So funny story, I didn't start Speedoc. The guy who started Speedoc is my friend, Dr. Shravan Varma from Singapore. When he told me about the idea, I told him this would never work. And when he raised a very, very large round, he called me up and he said, bro, we need to talk. I just raised money. Do you want to join us? And I said, I have no experience running a hospital. How would I know how to run a virtual hospital? And he said, no one does. That's the point. We just need people to figure it out. Can you figure it out? That is, I think, because at every stage, when I talked about P&L management, for example, I would say, hey, I'm not an accountant. I don't understand this. I don't know how And the only question that my boss asked me was, you've done surgery, right? How hard can accounting be? I was like, yeah, actually, yes. How hard can anything else be? We've gone through the worst kind of experiences in our training. We have second-guessed ourselves. The first time I stepped into an operating theater, I had to vomit immediately, almost violently. And I sat through all of it, and I went back again and again and again and again. And I realized, how hard can anything else be after that? Truly, right? I think just understanding certain concepts is hard, but this is what communities like Disruptive Doctors are really for. It is really almost a fraternity in terms of starting something on your own. While I have never started something on my own fully, I find that founders who work with other founders just for moral support, emotional support, they really, really punch through any of the hurdles that come. So I would say, don't worry about the execution. I would say worry about the emotional and moral support more than anything else. It's a lonely path, and you need community with you. I think I was very, very clear with my presentation, and there are no questions.
Yeah, there are no questions. Well, then thank you so much, Shreyas. Much appreciated. Thank you very much for your insight and your knowledge. Thanks for sharing.